I'm Dr. Shivendra. I'm an orthopedic surgeon in Lucknow, doing a private practice. Today we are discussing about the most common disease, which is osteoarthritis of the knee joint. So first we'll discuss about the what is osteoarthritis, how it develops, what are the symptoms, and what happens, and medication of the osteoarthritis. Treatment, which is part of the treatment of the osteoarthritis. What is osteoarthritis? Osteoarthritis is chronic degenerative. It is a chronic degenerative disease, which is most common is the knee joint. Knee joint because it's a weight-bearing joint. So it happens usually middle-aged and elderly people. It reduces the quality of life. So that's why we have to create the awareness about this joint and this disease, create awareness about this disease. So first we already discussed what is osteoarthritis. Now how it develops and what category of patient is usually most common. This first criteria is overweight people, and if a patient is having sometime trauma, so there can be traumatic osteoarthritis, and these are the things we can modify. And unmodified, there is unmodified also, there is a genetic also, and age related issues, and plus more common is female also because they have more laxity and all. So second part is what category of patient and how it develops. And third, we will discuss about the symptoms. Symptom is most common, which is pain and swelling in the knee joint, and there is a crackling sound is also that can cause a osteoarthritis long term if people are having, and a stiffness in the knee joint while getting out from the bed, and long if patient is long sitting with the knee folded. So these are the symptoms. So what happens basically in this disease? There is a cartilage degeneration on the knee joints. If cartilage degeneration of the knee joints, because that cartilage become brittle and thin. So and there is a space reduced in the knee joint. If we can discuss about this disease, you can see this X-ray. This is a normal medial space and lateral space are there. If you will see the another part of that knee, there is a almost reduced joint space, and there is a bony spur also, which is we call the osteophytes. So patient is having a more problem in this kind of joint. So there is a knobbing also, which I have already discussed, and sometimes synovium get inflamed, and which creates a more liquid also, so it create a pain in the knee joint. So these are three things we have already, four things already we have discussed. Another part is management. Initially, if patient is having a swelling in the knee joint, so we can put the instant if patient is having a swelling, we can put the ice packing over there. And usually orthopedic surgeons are previously prescribing the NSAID, which is called the painkiller in our society. So it's very common, but painkiller is creating a GI disturbance, abdominal discomfort for the patient, and plus long-term painkiller create the harm for our body, which is maybe the kidney damage also. So nowadays newer drugs is there, nutraceuticals are there, which is collagens and Boswellia serrata and curcum, black pepper, lots of things, and lots of things are there in nowadays in the market. Earlier we used to glucosamine, but nowadays that collagens are very good for the cartilage regeneration, but you have to take the longer term if you want the result. You have to take 4 to between 20 weeks minimum, so that then cartilage can develop. Many of the studies in available and publications are there. So it is gives the good result. Another part of medication, same as it is what joint fluid, which is hyaluronic acid, and available in the market also, that prevents the that prevents the lubrication and cushioning of that joint, and protect the further damage of that joint. So we can give these kind of treatment. We can prolong the disease, or we can avoid the disease. Patient cannot develop the osteoarthritis if he is following from starting onwards. And another part is cut. So we discussed the treatment about the painkiller, and there's nutraceuticals, and another is hyaluronic acid, and another part is physiotherapy. Physiotherapy we have to discuss because physiotherapy is playing a big role in our for the patient who's developing a osteoarthritis. In physiotherapy, your physiotherapist can give the modalities also, and plus there is exercises of the knee joint, surrounding of that knee joint, like quadriceps and sciatic nerve stretching. So these are the things we can avoid the osteoarthritis, or we can prolong, that disease can prolong for longer time, and patient may be benefited. So I wanted to give this information to our society, so many of the people will be benefited. Thank you.